Well, good morning and thanks so much for joining us. The spine is among the most important parts of the human body that consists of bones, discs, joints, and ligaments that provide structure and movement to the body. So it's not a surprise when I say that any problem with this complex system can lead to serious pain or neurological problems. Here to discuss one of those and how to fix it is neurosurgeon Dr. Matthew Wilson. Doctor, thank you so much for joining us today.
Thank you for having me.
It's a pleasure. And let's start off really basic, really broad. For folks who may not know, what does a neurosurgeon actually do?
I think in its most simplest answer would be operate on the central nervous system, peripheral nervous system, and spine.
And a common thing that happens to people is they have back pain. And a lot of people live with it day in and day out. What are some of the most common causes of that?
We see a number of different conditions that lead to back pain. Ruptured discs in the lower back. Spinal stenosis is a very common one in the Tucson population. Basic degenerative arthritis of the spine. Fractures are common in this part of the country.
Yeah, and so spinal stenosis is one of those problems that you mentioned, and you say it's very common, especially with those, I think, above age 40 or 50, is that correct?
Yeah, I think with each passing decade it gets a bit more frequent.
It's a bit worse. And so what are some of the symptoms that people can look out for?
People will frequently complain of pain in their back, pain down one or both legs, fatigue in their legs even without pain, numbness or tingling in the legs are all common things that people will tell you.
Yeah, and then, somebody listening may say, well, that's me, and they go to a doctor. How exactly is it diagnosed to know that it's spinal stenosis?
Very often a history, just simply talking to somebody who sees it with some regularity would be enough, but it would always be confirmed with either an MRI or a CAT scan.
Yeah, and well, thankfully, modern medicine has come so far. There are various ways to treat it. What's the treatment like for something like that?
I think everybody would try a conservative measure, I think, depending on the severity of the problem as seen in the images and in the symptoms, so that physical therapy and simply moving, whether it's walking or swimming, are important ways to keep people active. There are invasive pain management treatments. Epidural steroid injections are frequently used, but surgery, among the many conditions that afflict the lower back, surgery winds up being one of the more common treatments for it.
Right, and there are various ways of going about the surgery depending on what your doctor says is right for you. There's a fusion option and a non-fusion option. What's the difference there?
So when we fuse somebody's spine, we are essentially turning two bones into one. We're putting screws into the bones that we wish to fuse. And it's quite an involved operation, quite a lengthy recovery period. Certainly has a time and place, but needs to be necessary in order to be worth having gone through all of that. Mm-hmm. Non-fusion is the absence of that. We unpinch the nerves and that's the end of it.
And you have something actually these days called Coflex, which is one of those non-fusion options. Who's right to have that surgery?
So Coflex has been a real important part of my practice in the last several years. I think that anybody who's having a laminectomy, which is the unpinching of the nerves, could stand to benefit from having a Coflex inserted. I think the people that may benefit the most are those people who didn't have a fusion because of its use. That the Coflex is very important in stabilizing the spine without fusing people, and in that way has been really important in shortening patients' length of stay in the hospital, shortening the length of their operation, shortening their recovery periods. But even for those patients who would not have had a fusion, the success rate of the operation is substantially higher. Less post-operative pain, less likelihood of needing another operation down the road, so that it's been very helpful.
Well, that's music to people's ears. If it's a one-and-done surgery, you're not going to need anything down the line. It's going to make a lot of people's ears perk up. And you brought a model with you actually to demonstrate the Coflex.
Yeah, it's a pretty simple device. I think that when you look at it, you wonder how it could be responsible for such changes in people's practice patterns. But essentially what we do is unpinch the nerves, which run in this space between your spinous processes. And when we're finished unpinching the nerves, we tap that in. It locks to the spinous processes and allows for added stabilization compared to what we would normally do.
Incredible. And you say the recovery time is less than a fusion, you know, and people are going to be covered by insurance with this or no?
Yeah, it's covered by pretty much every insurance, and so it's done widely.
Fantastic. And so it's going to retain their mobility in a lot of ways. And if people, you know, if they think they might have this problem or they have something else going on with them, how can they make an appointment with you?
So Western Neuro, phone number would be 520-881-8400. You can find Coflex online, and that website would allow you to search. And then WNSAZ.com is another website that they can find us there.
Fantastic. Well, a lot of good information, you know, a lot of science behind it. We love seeing doctors come on here and explain their craft. It's always fascinating. So, Dr. Wilson, I want to thank you so much for joining us.
Thank you for having me.
Absolutely. Now, to make an appointment or to learn more, like we were saying, about Western Neuro and their 5 locations, please call 881-8400 or log on to WNSAZ.com or CoflexSolution.com.